Hello and welcome to Medical Facts. I'm Dr. Rena Malik. If you've experienced an orgasm but noticed little to no semen coming out, you're likely concerned and wondering if something is seriously wrong. I want to give you the truth today. This occurs for more men over 55 than you might realize, and while it can signal underlying issues, it's often manageable and sometimes completely reversible. The real questions are, why is this happening? What is my body trying to communicate? And what can I actually do about it? I've dedicated my career to helping men navigate the changes that come with aging, particularly in sexual health. This channel is about providing you with clear, evidence-based information you can truly use. Today, we're discussing a topic many men feel too embarrassed to bring up: dry orgasm and retrograde ejaculation. I'll walk you through what recent studies indicate, explain the physiology, and outline what realistic changes you might see in 1 to 3 weeks with the right approach. If you're new here, consider subscribing to Medical Facts for more conversations like this one. We will cover 4 essential areas. First, understanding the critical difference between a dry orgasm and retrograde ejaculation, because they are not the same. Second, the medication connection, since what's in your bathroom cabinet could be the primary cause. Third, the massive role of prostate health and surgical history. And fourth, what this all means for your pleasure, fertility, and overall health. By the end, I'll provide a straightforward, natural protocol, a checklist you can save and begin today. But before we start, I'd love to know who's in our community. If you feel comfortable, drop your city and age in the comments below. It helps me connect with you and understand who we're speaking to today. Now, let's begin by clearing up the confusion immediately. When no semen emerges during ejaculation, you're dealing with one of 2 scenarios: a true dry orgasm or retrograde ejaculation. They sound similar, but the mechanics are entirely different. Understanding which one you're experiencing changes everything about how you address it. A dry orgasm means you have the sensation of climax, the muscle contractions, the pleasure, but your body simply isn't producing semen, or it's producing very little. This can happen due to low testosterone, certain neurological conditions, or after specific surgeries where the prostate or seminal vesicles were removed. Think of it like a car engine revving, but the fuel tank is empty. The system is working, but there's nothing to deliver. On the other hand, retrograde ejaculation is different. Your body is producing semen, but instead of exiting through the penis, it takes a detour backward into the bladder. Afterwards, when you urinate, your urine might appear cloudy because it's mixed with semen. The plumbing is intact, but the traffic is going the wrong way. Why does this become more frequent after 55? Age brings changes. The muscles that control the bladder neck, the sphincter that should close during ejaculation to direct semen forward, they can weaken. Prostate enlargement, which affects the majority of men as they age, can also interfere with these mechanics. Diabetes is another major player because it can damage the nerves that control ejaculation. Studies show up to 35% of men with long-term diabetes experience retrograde ejaculation. Then there are surgeries, particularly those involving the prostate or bladder neck, which can disrupt the sphincter's function. Common triggers also include medications, which we'll dive into next, as well as spinal cord injuries, multiple sclerosis, or even heavy sustained alcohol use. The key is to recognize that if this started suddenly, it's worth investigating. If it's been gradual and you're on medications or have a history of prostate issues, the cause is likely right in front of you. The good news is that in many cases, especially with retrograde ejaculation from medication or muscle weakness, there are practical steps you can take. I'm not talking about expensive treatments or invasive procedures right away. We will get into natural, actionable strategies that can make a difference. But first, you need to determine if what's in your medicine cabinet is a factor. And that's exactly what we're covering next. Here's something many men don't realize. The pills you're taking to manage other health conditions might be directly influencing your ejaculation. I am not suggesting you panic or stop taking anything. Absolutely not. But you need to be informed so you can have a productive conversation with your doctor. Let's talk about the biggest culprits that might be in your medicine cabinet right now. Prostate medications are at the top of the list. If you're taking alpha blockers, like tamsulosin, alfuzosin, or doxazosin for an enlarged prostate or urinary symptoms, these drugs relax the muscles in your bladder, neck, and prostate. That's excellent for urine flow, but it also means that sphincter we discussed earlier stays relaxed during ejaculation. The result is semen flowing backward into the bladder. Studies indicate that up to 90% of men on certain alpha blockers experience some degree of retrograde ejaculation. It's not a defect in the medication, it's a side effect of its mechanism. Another class of prostate drugs, the 5-alpha reductase inhibitors like finasteride and dutasteride, can reduce semen volume over time because they shrink the prostate and lower the production of seminal fluid. Blood pressure medications, particularly older classes like certain beta blockers and thiazide diuretics, can also interfere with ejaculation by affecting the nervous system's coordination of the necessary muscle contractions. Antidepressants, especially SSRIs like sertraline, fluoxetine, and paroxetine, are notorious for sexual side effects. They can delay ejaculation, reduce semen volume, or in some cases cause a complete absence of ejaculate. The serotonin pathways these drugs affect play a significant role in sexual function. While they can be life-changing for mental health, the trade-off can be frustrating. Diabetes medications themselves don't usually cause dry orgasm, but uncontrolled diabetes does cause significant damage to the nerves controlling ejaculation. If your blood sugar has been poorly managed for years, you might have autonomic neuropathy, which disrupts the signals between your brain and your reproductive system. The medications aim to help, but the existing damage may already be affecting function. The same applies to certain medications used after prostate cancer treatment or radiation therapy. They can contribute to changes in ejaculation as part of the overall impact on pelvic nerves and tissues. Now, here is what you must understand. Never stop taking prescribed medications without first consulting your doctor. If you suspect your medication is causing this, schedule an appointment and ask directly. Sometimes there are alternatives with fewer sexual side effects. Sometimes the benefits of the medication far outweigh this particular inconvenience. That is a personal decision you make with your healthcare provider. Knowledge is power, and knowing the cause is the first step to managing it. If you're finding this helpful, please consider sharing this video with someone who might benefit from this information. Next, we're discussing prostate health and surgical history. If you've had any procedures in that area, that is likely a significant piece of the puzzle. If you've had prostate surgery, this section is especially for you. The reality is that any procedure involving the prostate, bladder neck, or surrounding structures can substantially affect ejaculation. It's not always permanent or complete, but understanding what happened and what to expect can save you considerable confusion. Let's start with TURP, or transurethral resection of the prostate. This is a common surgery for benign prostatic hyperplasia. During a TURP, part of the prostate tissue blocking urine flow is removed. The procedure often damages or removes the bladder neck sphincter, the muscle that closes during ejaculation. Studies show that 65 to 75% of men who undergo TURP experience retrograde ejaculation afterward. It's not a surgical error, it's a trade-off for improving urinary symptoms. The good news is that sexual pleasure, the sensation of orgasm, typically remains intact. Radical prostatectomy performed for prostate cancer is different. In this surgery, the entire prostate and seminal vesicles are removed. Since these structures produce most of the semen, you will have a dry orgasm afterward. There's no semen to ejaculate because the organs that make it are gone. Nerve-sparing techniques can preserve erectile function in many cases, but ejaculation as you knew it is over. That's a difficult truth, but it's important for setting realistic expectations. Many men report that orgasm still feels good, sometimes just as intense, because the pelvic floor muscles still contract and the brain still processes pleasure signals. It's different, but not necessarily worse. Other procedures like bladder neck surgery, treatments for bladder cancer, or even some hernia repairs can affect the involved nerves and muscles. Radiation therapy for prostate cancer can also cause scarring and nerve damage over time, leading to reduced semen volume or retrograde ejaculation months or even years later. The body is incredibly interconnected. Recovery expectations depend entirely on what was done. If the sphincter was damaged but not destroyed, pelvic floor exercises, which we'll cover soon, can sometimes help retrain the muscles and improve control within 8 to 12 weeks. If the seminal vesicles or prostate were removed, no exercise will bring back semen production, but strengthening the pelvic floor can still enhance orgasm intensity and urinary control. The realistic timeline is to give your body at least 3 to 6 months post-surgery to heal before expecting improvements. Nerves regenerate slowly. Patience is required. To make sure you don't miss our deep dive on pelvic floor exercises, be sure to watch until the end. Now let's address what all of this means for fertility, pleasure, and your overall health, because there's more to this than just missing semen. First, pleasure. Here's the surprising truth. Most men who experience retrograde ejaculation or dry orgasm report that the sensation of orgasm itself remains largely unchanged. The physical pleasure, the muscle contractions, the release, these are controlled by nerves and brain chemistry that aren't directly affected by where the semen goes. Some men even say their orgasms feel more intense after prostate surgery because the pelvic floor muscles compensate. Psychologically, it can be different. If you've always associated ejaculation with visible semen, its absence can feel strange. That's completely normal. But physically, the capacity for pleasure is still there. Fertility is more complex. With retrograde ejaculation and a desire to conceive, sperm are ending up in the bladder. However, it's not necessarily the end of the road. Urologists can sometimes retrieve sperm from urine samples collected after ejaculation for use in assisted reproductive techniques. If you've had a radical prostatectomy or your seminal vesicles were removed, natural conception isn't possible, as no semen is produced. In that case, sperm banking before surgery is the only way to preserve fertility, a point unfortunately not always communicated early enough. Regarding kidney and bladder health, retrograde ejaculation itself doesn't damage your kidneys or bladder. The semen mixes with urine and is harmlessly flushed out. However, if retrograde ejaculation is caused by uncontrolled diabetes, that's a significant red flag. Diabetic neuropathy can also damage nerves controlling your bladder, leading to further complications. So, if you have diabetes, managing your blood sugar is critical. Similarly, if this began suddenly with no clear cause like medication or surgery, it's worth investigating for potential neurological conditions. The psychological and relationship aspect also matters. Some men feel less masculine or worry about their partner's perception. Let me be clear, your value as a partner and man is not defined by semen production. Open communication with your partner is everything. Explain what's happening. Most partners are far more understanding than you might expect, especially when they see you're taking your health seriously. All right, now for the practical steps. Let's discuss what you can actually do. I won't promise miracles, but I will provide a protocol backed by physical therapy research that has helped many men regain better ejaculatory control, stronger orgasms, and improved urinary function. This focuses on strengthening the pelvic floor muscles, which control ejaculation, urination, and erectile rigidity. If your issue stems from partial muscle weakness or nerve damage, this can make a real difference in 4 to 8 weeks. Let's start with Kegel exercises, but done correctly. We're targeting the bulbospongiosus muscle and the external urethral sphincter. Here's how. First, identify the right muscles. Try to stop your urine flow midstream once without using your abdominal or leg muscles. That squeeze is your pelvic floor. Don't make a habit of this, but it helps with identification. Once located, you can do these contractions anywhere. Contract those muscles, hold for 5 seconds, then release for 5 seconds. Aim for 10 repetitions 3 times daily. As you get stronger, increase the hold to 10 seconds. Consistency is key. Make this a daily habit for at least 8 weeks. Hydration plays a bigger role than many realize. Dehydration affects bladder and urinary tract function, including the sphincter muscles. Aim for at least 8 glasses of water daily, and limit excessive caffeine and alcohol, as they can irritate the bladder and weaken control over time. Now, let's talk about supplements that support nerve and muscle function. Zinc is critical for testosterone and reproductive health. Men over 55 often have lower levels. Supplementing with 15 to 30 mg daily may help. L-arginine is an amino acid that improves blood flow and supports nitric oxide production, benefiting erectile and potentially ejaculatory function. A typical dose is 3 to 5 grams, but consult your doctor if you're on blood pressure medication. Vitamin B12 is essential for nerve health, and deficiency is common in older men, especially those on medications like metformin. Ensuring adequate B12 levels can support nerve regeneration over months, which is worthwhile if nerve damage is involved. Lifestyle adjustments matter too. If you're overweight, losing even 10 to 15 pounds can reduce pressure on your pelvic floor. Regular, moderate activity like walking, swimming, or yoga supports pelvic health. Avoid heavy lifting that strains the pelvic floor until you've built strength. And crucially, if you have diabetes, manage your blood sugar. High blood sugar damages nerves, and preventing further deterioration is essential. This protocol isn't flashy, but with an 8-week commitment, you'll likely notice improvements in control and intensity. Some men regain partial forward ejaculation, others simply feel stronger. Either way, it's progress. If this video was helpful, please subscribe to Medical Facts and turn on notifications. We cover topics your doctor might not have time to explain fully. Let me know in the comments what you'd like to see next. The main message is this: if you're experiencing dry orgasm or retrograde ejaculation, you are not broken and you are not alone. In many cases, this is manageable and even treatable, whether it's adjusting medications with your doctor, committing to pelvic floor exercises, or simply understanding your body. You have options. Knowledge is power, and taking action, even with small steps, makes all the difference. Thank you for watching.